Welcome back to 101 East. The cost of some drugs in Indonesia can be very expensive, even by international standards. The government scheme here aims to help the poor buy affordable medicines, but not all succeed. One family tells us of their struggle to gain medical care for their sick child.
I have to admit that my son's growth is below normal for his age. He looks more like a 6-month-old than he should. He isn't very active. My name is Haj Rudi Hartawan. I'm 41. My youngest son is Muhammad Rizki Fahlevi. He's 1 year old. At the beginning, Rizki had a high fever, and I didn't know the cause until the 13th day. We took him to Persahabatan Hospital in East Jakarta, and there we found out that he had anemia. The first thing I worried about was pain, because I knew that the treatment wasn't simple. We had to get a lot of money for the treatment, and we have to pay to go to and from the hospital. With me being jobless now, it's going to be hard for me to get the money. But I'm going to try my best, because my son is my responsibility. Who else is going to take care of him except me? I have to get money, but of course, I don't have it. So I had to borrow it from my neighbors, my old friends, where I used to work. We had to let lots of our possessions go. In the end, I didn't have anything left to sell, so I was forced to borrow money. I don't know how to pay them back. I haven't bribed anyone yet, but I have some friends that I saw doing this kind of thing, and it commonly happens during the house-to-house survey. This is where the decision is made, whether you should get the health insurance or not. I actually could be angry because it's my right, but the problem is that I don't know who to be angry with. This kind of bureaucracy has been here for a long time. It's straightforward. They say if you follow our way, we will help you. If not, it's up to you. Of course, as a parent, any kind of parent, we certainly hope this kid is going to be healthy. And I also hope I can give him a proper education for his future. But the biggest priority at the moment is that I want him to get better, totally cured.
For more on the issue of Indonesia's health sector, we continue with our discussion. And Fahmi, can I just throw this question to you? We heard about the government insurance scheme. It's a very noble scheme. It's set up to try and help poor get affordable medical treatment and medication as well. Why is this system failing the people then?
From our perspective, from Indonesia Medical Association perspective, it's a good start, but the health service system not support. And
why isn't it strong right now?
It's not
what
strong
is the
now.
weakness in this system? Why?
Because always think about to cure, not think about to prevent. Chronic disease is the important thing is promoting and preventing. If you talk about cure, promote chronic disease, is never enough money.
Hasbullah, we're talking about systems here. Is it time to admit that decentralization has failed? Is that the main problem with the health sector in Indonesia?
No, I don't think the decentralization failed as the main problem. In fact, decentralization is still not adequately implemented. It's not well described and between the role of the central and local government. It has to be more clearly defined.
Well, you have the local government in charge of immunization, in charge of their own health budget.
No, the local government is not in charge of immunization, but by the law of autonomy, the local government is in charge for the health care. Unfortunately, most of the local government, they just do not know what to do, and they always still have the old culture. They depend to what the central government say. And actually, if we talk about system, I say there is no system in Indonesia, no health system at all. So if you say about the insurance, there is a law on this insurance, but still not clear how to implement it.
No, we have a health system. We have through the
No,
minister, but not implementation adequately. It's a problem.
You disagree?
I disagree at
Indonesia
all.
does not have a health
any
system,
health
according
system.
to you.
I
Because
think
what
the
they
health
call-
system does not work properly.
No,
So, and
it's
therefore,
not proper.
therefore, you know, the result is nothing.
What they call the health system, the national health system, is actually
well, it
what
is on
vague,
paper.
it's on paper, and it's
not
full of vague sentences, and it's full of ideals, which is it doesn't talk about what to do and what to achieve.
No, if I can interrupt this. Okay, I agree. Every system has a weakness. Every system, especially if you write in the paper. But the problem is not about the weakness of the concept. The problem is implementation.
Well, even the concept is still not appropriate. This concept is not clear enough.
But there's something that you gentlemen are not addressing, though. What about accountability? Local councils don't seem to be held accountable for their actions, for their budgets.
That's what I mean, that there is no system
regulation.
At all.
Because that's why I said, because the regulation is not clearly defined, which is the role of the central and the local.
Well, this just opens the system up to corruption and abuse as well.
I agree with the two of them. I agree, but Indonesia is a big country. Okay, in general, so many local government not work well in the healthcare issues.
Yeah,
but one or two or three is still so local. We can see not all the local government is.
Yes, of course. If I say that local government, it doesn't mean that all of local government. But if some local government do that, and most of them don't do that, it means there is no system.
Hezbollah, given the high number of bird flu deaths in Indonesia, and the fact that the whole world is watching Indonesia for fear that the global flu pandemic may actually start here, are their fears justified?
Well, yes, the fear is justified. Well, I'm afraid the health services might not be adequate to tackle this disease, given the nature of bird flu can occur anywhere in Indonesia, while the high-tech medical and specialists concentrated in the big cities only.
No, I think what he's talking is the healthcare system is not prepared to take care of that. And I don't agree that the bird flu infection is sophisticated in terms of how to detect or how to cure that, because the technology is there. I mean, actually, if every health centers in the rural areas everywhere in Indonesia being given kind of direction or guidelines how to detect and how to treat the suspected bird flu infection, I think it's not a big.
No, thing about just healthcare system is a medical service. WHO said if you want to have the good handle for the bird flu, first is public awareness. The key is public awareness. A second, surveillance, and the third, the compensation program.
Is the government doing enough in all three?
It's about talk about public awareness. Talk about the health system. Who the first point of contact? The strengthening in the front line. It's very important to strengthen the front line.
In the fact that our mortality, specific death rate, the mortality is specific mortality rate for the bird flu is very high, meaning this is the medical technology, the medical treatment is inadequate, or the late diagnosis.
Early diagnosis not work because
early diagnosis doesn't work.
The primary medical care
is
not strong.
That's not a good quality of medical care. Therefore, high mortality.
No. It's also the lack of preventive measures. So not only the care after the people are getting sick, but to prevent, how to prevent that kind of outbreak, and how to reduce that mortality rate, because Vietnam has succeeded in that, to reduce. Before, Vietnam has higher mortality rate than Indonesia, but now Indonesia is the highest in the world in the mortality of bird flu.
This is true. I just want to move on now. Kartono, you are part of the coalition of Healthy Indonesia 2010.
Without 2010, just coalition for healthy.
You've dropped the 2010.
Yes, right, because it's impossible to get
To next
healthy
year, to get
Indonesia.
to next year.
So you're not confident at all. Now you've actually had to change the coalition's aims of a healthy Indonesia 2010 because it's next year and you're not confident that you'll be able to meet
Yes,
those goals.
it's impossible to achieve the goal of a healthy Indonesia in 2010.
If that's the case, then where do you start?
Well, first we must reform the health system, national health system, and put more attention on how to promote health, not only through healthcare, but through other measures. Health cannot be achieved just through provision of healthcare or medical doctors. We need clean water provision, environmental, sanitary, and education, something like that. So our organization is now concentrating more on the educate the people, not educate the government, because it's not our job to educate the government.
I don't agree with it.
You don't?
We did not need a reform of health sector. We have conducted 4 years ago. What we need, we force the government to implement it well. Redesign is all right, redesign. But reform,
well, redesign is a reform.
So you're
What's
happy with the
different?
design, you're happy with the policies that are already there. It's just that there is
Yes.
a need for more
we need
better
the implementation well.
implementation.
Yes.
And improving when implement is not well.
Right, I see. Hasbullah, would you agree with that as well? That the
Well,
design
I think
is
to
fine.
make more clear, for many people, reform sounds scary, you know. It's reform actually improvement.
Yeah.
The main issue of the reform is improving the system.
To make it more implementable,
Right.
because of this decentralization law. In the decentralization era like this, like today, we have to put more clear responsibility to this local government.
I think the problem in this decentralization, a lot of people don't really understood the nature of the healthcare. So a lot of local government are now fighting to get the role of, for example, in health financing. We are in debating. While this is a lot of externality, local government good in providing services directly because close to people, but financing should be nationwide. Otherwise, there will be inequity between regions, between the district. But now they are fighting everything as decentralized, for example. It doesn't work.
Gentlemen, thank you very much for joining us in this discussion. The Health Minister and her Director General initially agreed to be part of the show, but in the end declined. And that's all the time we have. From the 101 East team in Jakarta, Indonesia, thank you very much for joining us. We'll see you again next week.